FMGE, the Foreign Medical Graduate Licensing Exam. Everyone thinks it's easy because you only need 50% to pass this exam. But did you know the pass rate is just between 15 to 25%? That's where the real struggle begins. Hello everyone, welcome back to MedPrep by Academically, your go-to place for tips, strategies and guidance to crack medical exams. If you're new here, make sure to hit that subscribe button and turn on the notifications so you never miss any of your latest tips and tricks. Now, let's get started. So why is FMGE considered so difficult? Let's break it down. At first is the clinical exposure in India. Many foreign universities focus mainly on the theory part. And you might also know the textbook inside out, but FMGE asks you to think like a real doctor, something many FMGs aren't used to. Next is different curriculum and guidelines. FMGE expects knowledge of Indian protocols like ICMR and NMC. And diseases like TB, dengue and malaria, which are common in India, may not have been covered in depth abroad. And most important, lastly, there's underestimating the exam itself. Thinking it's not NEET PG, so it must be easy, is a trap. And lastly, skipping mocks or cramming at the last minute won't cut it out. And the syllabus is also huge. All 19 MBBS subjects are included from medicine to psychiatry. And revising everything twice before the exam becomes a real challenge. And then there is mental pressure too. Expectations from family, self-doubt, fear of failure can overwhelm you and even affect your exam performance. Which leads us to our next question, is FMGE that hard? Well, the answer is yes, it is hard, but it is not impossible. Thousands pass this exam every year, even on their first try. But then there is another question too. What makes this exam so tough? Well, the low pass rate, big syllabus, clinical focus, less guidance, and 300 questions in 3 hours. But what makes it doable? No negative marking, fixed passing score, repeated question patterns, online prep tools, and 2 attempts a year. And here's how to get through FMGE without stressing too much. First, have a clear plan. Break your preparation into 3 steps: learning, revising, and practicing. And honestly, studying consistently for 5 to 6 months works way better than cramming at the last minute. Next, focus on previous year questions. You'll see which topics keep repeating and what kind of tricky questions the examiners ask. Then take full-length mock test. It trains your brain to concentrate for 3 hours and shows exactly where you need to improve. Now, another tip here is always think clinically. Don't just memorize facts. Put yourself in the situation asked and think, how would you react if this patient is actually present? That way, when you see a case in the exam, it makes so much more sense. And also, using the right resources can save tons of time. Our FMGE preparation course gives you videos, notes, and lots of MCQs all in one place. It saves a huge amount of time and keep your preparation focused. So, if you are aiming for FMGE this year, reach out to our experts. Link is given in the description. And FMGE is tough, but you can beat it with strategy, consistency, and the right mindset. Remember, it's not about how hard the exam is, it's about how prepared are you. If this helped, like, subscribe, and tell us in the comments what's your biggest FMGE struggle. Let's crack this exam together. I'll see you super soon. Till then, happy studies. Take care, everyone. Bye-bye.